Hi, I'm Dr. Meier from Third Coast Foot and Ankle, and I'm going to discuss with you the common causes and understanding the reason we have heel pain. Now, the first step when we're treating anything is to really understand the root causes and what is going on internally that is causing the pain. When we understand the pain, it makes it obviously easier to treat it. We know what we're combating. So let's break down heel pain into its most common causes, and then we'll talk a little bit more specifically about how we treat the most common cause of heel pain. So first and foremost, the most common cause of heel pain is something called plantar fasciitis. It's a mouthful, but you have probably heard it before. You may have Googled it already, or a family or friend has talked to you about their heel pain caused by plantar fasciitis. So heel pain from plantar fasciitis is primarily in the bottom of the heel. And so this is smack dab. Every single time you step down, you're having that pain in the heel. This pain tends to be worse in the morning or after the first step of the day or after times of rest. So if you've been sitting down watching TV or maybe driving, you go to stand up and that pain is there. It sometimes dissipates when you're on your feet after a period of time, but typically comes back throughout the time. Now, another common cause of heel pain is Achilles tendonitis, but this pain is in a little bit of a different location. This is going to be on the back of the heel. So that Achilles tendon comes down and inserts on the back of the heel bone, and primarily that pain is right here in the back. It has a similar pain pattern where we're seeing that pain in the morning when we get out of bed or anytime after rest. There's some stiffness and pain in the back. Sometimes even our shoe rubbing the back of the heel can cause a lot of tenderness. These are, though, two separate, completely different conditions and diseases. And so if you're having both, then that's possible that you could be having both some tendonitis and fasciitis at the same time, but typically we're having one or the other. Now, some other less common causes of heel pain is going to be something like a stress fracture. So that would be the bone right here called your calcaneus actually having a fracture within it. Now, when people typically have like large fractures in the calcaneus or the heel bone, that's from falling, sometimes falling off of a roof. So that's a very obvious injury to this area. But stress fractures can be much more subtle. They happen from repetitive pounding on this heel. So more typically, we're seeing this in like a runner, a long distance runner that has a heel strike, and that repetitive motion is causing that stress fracture. Now, I will say that stress fractures in the heel bone, though can happen, are significantly less common than the plantar fasciitis or Achilles tendonitis. And so if it is a pain that is not going away, it is something we do want to rule out and make sure it isn't contributing to your pain. Now, other things that can cause heel pain, surprisingly, are sometimes skin lesions. Things like warts and calluses on the bottom of the heel can cause a very similar sharp pain every single time you walk on it. Now, we see this more typically in people who can't quite see the bottom of their foot very well. Sometimes even, foreign bodies stepping on a piece of glass can cause this chronic pain in the heel too. And so it's another thing to look at or look for, but a little less common than those traditional plantar fasciitis or Achilles tendonitis. So I'm going to switch gears and I'm really going to focus on that Achilles tendonitis and plantar fasciitis as those two primary causes of pain and discuss a little bit more about what is going on in those conditions. So let's start with Achilles tendonitis. Largest tendon in our body comes down and inserts at the back of the heel here. Now, some of us actually have heel spurs in the back here, which can aggravate that tendon and make it more susceptible to get tendonitis in this site. Typically what we're seeing here is inflammation within that tendon, sometimes even some small tears, depending on how much damage has inferred in this area. We often have a lot of tightness in our calf muscle or in our legs, and walking barefoot really aggravates this pain. So a lot of local inflammation and damage specifically to the tendon in the back of this heel, with the possibility of a bone spur aggravating or making it worse or more difficult to heal. Now, on the flip side, let's talk about plantar fasciitis. This is not a tendon, this is a ligament, which is a little bit different, meaning a ligament does not have a muscle attached to it. It's just a tight fibrous tissue that lives on the bottom of the heel. Starts from the heel bone and actually goes all the way to the toes. But its weakest spot is where it attaches to that heel bone. Now, there is oftentimes a bone spur here with the plantar fasciitis too, but unlike Achilles tendonitis, we don't really care about the bone spur at the bottom of the heel. Many studies have been done on this because we used to think this was the primary cause of pain. We now know that it is not a source of the pain. You can have a bone spur, you can live with a bone spur, and it does not mean that you will continue to have pain, and we do not have to really pay attention to it at all. There is no predictive value of your ability to heal faster or slower whether or not there's a bone spur there. So even though you're going to see on the internet they use bone spur and plantar fasciitis almost interchangeably, I want you to discard that idea of the bone spur really mattering. Now, where that ligament is attaching on the bone, as I said before, is its weakest point. What's happening here is an overuse injury. That ligament is being overused. Now, you can imagine it's a very large ligament on the bottom of our foot. We are going to overuse it quite easily just by walking. Now, the most important thing to do to support this ligament is to wear shoes, avoiding walking barefoot. Those are the primary causes. So we see this a lot in the summertime when people are switching over to flat flip-flops or even walking around barefoot a lot poolside or on the beaches. But we also see this for a lot of people that convert to working at home or being in their house all day without shoes on. That lack of support can really cause this ligament to be overused. Now, we can also just overuse our ligaments just from activity, right? We're active people. And so it may be you were on a vacation, you were doing a lot of hiking, you tried a new activity, you were on your feet more than normal, and your body maybe wasn't conditioned for it. That ligament then can become strained. Sometimes this ligament will actually get small tears in it. Sometimes it can actually rupture all the way through, but that's pretty rare, and usually that's a significant event where you would have noticed a sharp increase in pain. More commonly, what we're dealing with is local inflammation, swelling, and thickening of this ligament at that heel bone. Now, if you're listening to all of this and it doesn't quite fit the parameters of your heel pain, I'm going to recommend that instead of trying to treat through this at home, that you go ahead and skip the course and you go and make an appointment with your local podiatrist or us here at Third Coast Foot and Ankle, because the most critical step to getting better and getting better fast is having the right diagnosis. And so if you are unsure of your diagnosis, if you are unsure whether or not it could be a stress fracture, plantar fasciitis, Achilles tendonitis, or maybe even something weird with the skin, then it's best to move forward with getting that diagnosis to get better faster. So I hope this information helped you create a baseline for what needs to happen next.